Good morning. My name is Dan Clair. I'm the chairman of the Department of Vascular Surgery at Vanderbilt University Medical Center. So the FORWARD IDE study was to evaluate the performance and safety of a forward emitter on intravascular lithotripsy catheter. So in many instances, crossing heavily calcified lesions, even with standard balloons, was challenging. And by having a device with a forward moved emitter, this would hopefully enhance crossing of very complex calcified lesions. And the study was designed to assess the performance of the device in this setting. So the study design was a single-armed prospective multi-center trial to evaluate the performance of this in moderate to severely calcified lesions below the groin. This was designed to look at lesions in the SFA that were more than 90% stenosed and more than 70% in lesions below the knee. And ideally, this would assess the ability to enhance crossing of these very heavily calcified lesions. Now, the trial did include a requirement that there was wire crossage prior to advancement of the device over the wire. So the initial findings at 30 days and at procedural performance was that there was close to a 97% ability to deliver the catheter and get across the lesion. But there were some lesions which were difficult enough to cross. In the vast majority of patients, this involved a single catheter use, and there was a mandated post lithotripsy angioplasty that was done, and better than 98% of the patients had less than 30% residual upon completion of the advanced catheter and angioplasty alone. So there was one patient in the first 30 days who had a myocardial infarction and passed from the myocardial infarction. And I believe there was one additional patient who had distal embolization that was able to be retrieved during the procedure itself. The device itself is now in essentially what is increasing limited market release. And the idea behind this is to try and see how the catheter performs in real world settings. My own impression from having used the device in cadaver models is that this will clearly enhance our ability to use the product or to use any product, frankly, in heavily calcified lesions where we've had trouble even advancing crossing catheters. I do think this, while not in the trial, I do think this will be used in areas below the ankle where extreme calcification can be seen and where crossing of lesions can be incredibly challenging. I would just say that I think that this device performs and should be expected to perform in a similar manner to the multi-emitter balloons that Shockwave has in use currently. And I think its combination with the newer, lower profile E8 catheter, which Shockwave recently released after trial data as well, will, at least in my view, increase the opportunity to utilize this technology and to deliver interventional therapies for patients with critical limb ischemia.